Hi everyone, welcome back to my YouTube channel. Today we are going to talk about osteogenesis imperfecta. We will start our topic with introduction. Osteogenesis imperfecta, often called as brittle bone disease. It is hereditary disorder characterized by bone that fracture easily with minimal or no trauma. The underlying problem is related to defective connective tissue that is primarily due to abnormalities in type 1 collagen, a key protein that provides strength and structure to bones. Now we will talk about the causes of osteogenesis imperfecta. Osteogenesis imperfecta is typically caused by mutation in COL1A1 and COL1A2 gene, which are responsible for coding type 1 collagen. These mutations lead to either reduced production of collagen or production of abnormal collagen, thus weakening the bone matrix. This condition is inherited in most cases and is autosomal dominant pattern, meaning that one copy of mutated gene from one parent is enough to cause the condition. Rare form of osteogenesis imperfecta may follow autosomal recessive inheritance required mutation from both parents. Now we will talk about types of osteogenesis imperfecta. Osteogenesis imperfecta is categorized into several types based on severity, clinical features, and genetic mutations. The first type is type 1, that is mild. It is most common form. The individuals have normal height and experience multiple fractures throughout life. Fractures include blue sclera and hearing loss. The second type is type 2, that is severe or fatal. It is often lethal shortly after birth due to respiratory failure or severe skeletal deformities. Third type is type 3, that is severe. Bones break easily and individuals often have very short stature and severe skeletal deformities. Fracture may occur even before birth in utero fractures. Fourth type is type 4, that is moderate. Symptoms range between mild and severe forms with variable skeletal deformities and reduced height. Other rare types include type 5, type 6, type 7, and type 8. There are less well understood and exhibit distinct features unrelated to collagen mutations. Now we will talk about symptoms of osteogenesis imperfecta. Osteogenesis imperfecta affect more than just bone. Some key symptoms include bone fragility that causes frequent fractures, often with minimal trauma. Then the symptom is blue sclera, that is a bluish tint in the whiteness of the eye due to thin collagen layer. Then they exhibit short stature, that is due to growth issues due to skeletal abnormalities. Then there is hearing loss, that is conductive or sensory neural hearing loss is common in certain types. Further talking about symptoms, the patient also show dental issues. Teeth may be prone to wear, breakage, and discoloration, known as dentinogenesis imperfecta. They may also show joint laxity, that is increased joint flexibility due to weak connective tissue. They also show respiratory problems. In severe cases, malformed rib cages may lead to breathing difficulties. Now we will talk about diagnosis of osteogenesis imperfecta. Diagnosis of osteogenesis imperfecta typically involves clinical evaluation, that is assessing history of fracture and symptoms like blue sclera. Then it involves imaging techniques that are X-rays to identify bone abnormalities and deformities. Then we can also do genetic testing for diagnosis, that is to confirm mutation in collagen related genes. And we can also do bone density test to evaluate bone strength. Now we will talk about management and treatment options for this osteogenesis imperfecta. There is no cure for osteogenesis imperfecta, but management focuses on improving quality of life. So it relies on medications that may include bisphosphonates. These drugs help increase bone density and reduce fractures. Then management or treatment may also involve physical therapy, that is exercises to enhance mobility, strengthen muscle, and reduce fracture risk. Then there is surgical intervention, that is intramedullary rodding, That is, metal rods are inserted into long bones to stabilize and prevent deformities. Further, in management and treatment, we can also give patient assistive devices that are use of wheelchair, braces, or other aids to support mobility. And we can also suggest patients some lifestyle changes, that is avoiding high risk activities to prevent fracture, and a balanced diet rich in calcium and vitamin D to support bone health. And we can also suggest these patients for psychological support so that they are able to cope with the strategies and counseling for individual and their families. Now we will talk about prognosis of osteogenesis imperfecta. The prognosis of osteogenesis imperfecta varies depending on the type. Mild form, that is type 1, allows individual to lead relatively normal lives, but when there is severe form, it may require lifelong medical care, and type 2 can be fatal. So this was all about osteogenesis imperfecta. If you like our video, don't forget to like, share, subscribe and comment. Thank you so much for watching.